Thank you very much. Welcome to today's webinar, an ISTP webinar titled The Current Humanitarian Situation in the DPRK. It's a very timely topic, although today we will focus on the humanitarian situation, although there are many issues, many other topics, of course, that can be discussed when it comes to DPRK. But the humanitarian situation is a concern of everyone, not least the people of the DPRK. So I think that it is fair that we try to concentrate on that situation. What is needed, what is possible, and what can be done, what should be done, and what should not be done, and so forth. My own name is Lars Varje. As Eva said, I'm head of the Japan Center. With me today, I have 4 distinguished panelists, very knowledgeable. I have Dr. Ki Park, who is the director of the North Korea program at the Korean American Medical Association. We also have Ms. Åsa Sandberg, who is the head of the DPRK desk at the Swedish Red Cross. And then we have Dr. Bernard Seliger, who is a representative of the Hans Seidel Foundation, Korea. And finally, we have Dr. Sang-Soo Lee, who is the head of the ISTP Korea Center. We will, first of all, we will let everyone speak for some 15 minutes or so. Then we'll have a small discussion between ourselves or between the speakers. And there will also be some time for questions and answers. With that, I'm very pleased to give the floor first to Åsa, and I'm eager, like everybody else, to listen to her presentation.
Thanks a lot, Lars. Let me see if I can share my screen. So good morning, good day, or good evening, everyone. My name is Åsa Sandberg. As Lars mentioned, I am working for the Swedish Red Cross in Stockholm, where I'm the head of desk for DPRK, which means that I'm responsible for the coordination and support to the DPRK Red Cross. So I will give you a brief description of the work and mandate of the Red Cross in the DPRK, and also the unintended effects of the sanctions affecting our work in the country, and also how COVID-19 is affecting the work of the Red Cross. See if I can manage to switch slide here. So the Red Cross in the DPRK was founded in 1946. It's an organization which is part of the global Red Cross movement, which is consisting of the IFRC, the ICRC, and 192 national societies across the world. The DPRK Red Cross has 1 million members approximately, and about 100,000 volunteers in the DPRK. International support to the DPRK Red Cross started in the mid-1990s when the IFRC office was set up in Pyongyang. And they are coordinating all international funding from other partner national societies on the outside. The Swedish Red Cross has a long-standing partnership with the DPRK Red Cross. So we have been supporting them since the late 1990s. And this means that we have a good working relationship and built on common trust, which has also given us a good access to the field and communities and insights into the work of the Red Cross in country. The Red Cross has a specific mandate and are united by our common principles across the world. This this means that the Red Cross in each country has a specific role and a specific mandate within its own society. And it's the same, of course, for the DPRK. So the Red Cross in country has a structure, a setup with the branches and offices across the country in all provinces. It has a role in disaster management and is a first responder in emergency situations. The DPRK Red Cross also holds an auxiliary role to the government. And this is something that the Red Cross holds in every country that we're active in. In terms of the humanitarian needs, very, very briefly, we know that the UN has defined more than 10 million in country to be in need of some kind of support for 2020. And this was defined before the pandemic hit the world. There's a lack of basic sufficient health care across the country. Also, access to clean water is an issue to many people. And of course, the population is hit in different ways negatively related to natural disasters and emergencies, which we have seen just recently with the typhoons hitting the country. In terms of the main focus of our operations, the National Society is running a holistic integrated program with a number of components covering disaster management and preparedness. On this picture here, we can see a river embankment strengthening to protect communities from floods. For example, in terms of health, it's a community-based health approach, working very locally with household doctors and nurses, with information campaigns, hygiene information, for example, health promotion activities. In terms of water and sanitation, it's focused on safe water supply, hygiene awareness, of course, contributing to the health aspects of the people. And then in terms of agriculture and livelihoods, it's focused on the food security aspects, which is a main challenge in the DPRK. As an example, we have greenhouses to provide vegetables, extra vegetables to people on the countryside. So since we have a structure as the Red Cross that is set up throughout the whole country, and we have volunteers involved who are themselves part of representing their own communities, we also have a very close connection to the end beneficiaries or the people in the field and their actual needs on the ground. And of course, we have a privilege also being this close to the communities. And we have a possibility to have a dialogue on the needs of these people. And this is something that is not always easy, but it's something that we're always emphasizing and working on as a primary focus. And in terms of before COVID, I would say the Federation and also ourselves when visiting the DPRK has had a very good access, like I mentioned, to people on the ground and field visits for monitoring also of the operations that we're supporting. Of course, this year we have had a huge backlash in terms of monitoring because of COVID has contributed to restriction in movement and so forth. But generally, monitoring is something that we have setups for and systems, of course, both financially and operational systems in every place and country where we're having implementation of programs. And coordination is happening with other actors in Pyongyang and also on the outside in different matters. And the Red Cross has also coordination mechanisms internally within the movement, how to support and collaborate on on how to best support the national society. And Swedish Red Cross is much engaged in this coordination. When it comes to the sanctions and the unintended effects on our work, the exemption process to the UN Sanctions Committee was something that became especially difficult for us after 2017, in 2018, and something that we worked on with other actors as well and partners to raise this issue in different ways. And now the exemption process is much smoother. In terms of funding, over the years, we've seen diminished funding for operations, and it's difficult to attract donors and funding to our work. There's a reluctancy to give, also, of course, influenced by the global politics in the world. We've seen a collapse of the banking channel, which makes it difficult to all humanitarian actors in country, since, of course, payments and transfers of money is a challenge. We have also, there are some complications related to this in our procurement and bringing in goods into the DPRK. And suppliers have been fewer over the last years, and logistical companies are hesitant to ship goods to the DPRK, even if they're tagged as humanitarian goods. Also aspects related to customs clearance, etc., is a challenge. And all of this is also increasing the cost of humanitarian operations overall in different aspects. And not the least, the administration around this and understanding the procedures and systems, how to manage the sanctions regime is a bit complicated and be quite resource heavy, so to say. And we are, of course, keen on following the regulations that are in place. So overall, it's a quite strenuous working environment. It's stressful, it's uncertain, and it's short-term planning, basically, with financing that is usually quite short term, and there's a high staff turnover as well. And this, the main problem here is, of course, that we're not able to be effective and to deliver the service that we're there for to serve. That's why we are in the DPRK as humanitarians, and those who are in most need are, as in many other situations and places in the world as well, are the most hard hit by the restrictions being put on our work as well. When it comes to COVID-19, we know that the borders have been closed since January, so we haven't been able to physically visit ourselves. And there is no field access in the country for international staff. The Federation office that we have there have at the moment 3 international representatives present, and they have not been able to visit the field since January. There are no imports basically allowed except COVID-19 supplies, and this was even enhanced in July, the restriction on imports. And this is causing also delays in our regular programs, where we a lot of times are also dependent on bringing in material to that work. Communication has become more complex, and our dialogue with the national society in country. There are restrictions on communication and on physical meetings between the IFRC and the national society in country. Emails were cut off for a while, but we managed to have them open again, so that national staff can also have access to their emails. That helps a lot in the day-to-day work. We see that less data is shared or available, even though the national society is active on the ground as normal in a way. They're still running their programs and are also active in the emergency response actions that are taken in the COVID-19 response of the country. But less information is shared with the outside. Also, our representatives are isolated in Pyongyang, like I mentioned, and there is no replenishment of cash. Since there's no bank channel, there is no way at the moment to bring in money to the work to pay for day-to-day activities, but also longer-term investments, procurement locally, for example. And then in the disasters that we have seen recently, no international support has been asked for, which means that we also have very limited insight into the response work. So all in all, this context that we're in is causing a number of risks to the people. And especially worrying are the delays in suspended procurement and distribution of basic medicine and medical equipment, as well as water, sanitation, hygiene material. We also see a reduced capacity to provide emergency assistance to disaster-affected communities, at least with international support. We've seen that the country itself has responded as well. So generally, there's very little insight into the humanitarian situation today. And of course, there is a combined number of factors increasing also the needs of the people as we view it. We both have the sanctions, we have COVID-19 and economic effects of the situation. So there is, of course, a high risk potential that the needs of the vulnerable groups in country will increase. So as humanitarians, we have a responsibility to act. And our key messages are that humanitarian organizations must be able to deliver humanitarian assistance in a way that it does not compromise the humanitarian principles. And guided by these principles, the Red Cross, Red Crescent movement partners have a responsibility to advocate for financial commitment, to implement the humanitarian assistance as per the Red Cross operational plan in country. And the UN and its member states has a responsibility to monitor the humanitarian consequences under the present sanctions regime and ensure that financing of the humanitarian appeals are secured. The Swedish Red Cross, we are committed to continue our support to the DPRK Red Cross, and we do have some direct contact with them via emails and communication links, and they are reaching out a little bit on different primarily technical aspects and requests that we are trying to respond to. And they are definitely committed to continue their mandate and important role as a humanitarian actor in and responder in their own context. And as a Swedish Red Cross, we are determined to keep our line of communication and to keep our plans for the future open. Thanks very much.
Well, thank you very much, Åsa. It was very informative, and I'm sure that we will get some comments and questions later on. I now have the pleasure to give the word to Ki. We're looking forward to your presentation. Thank you.
Thank you, Lars. Can you all hear me? And can you all see the screen?
Yes.
Great. Yeah, thank you. First of all, ISDP for inviting me to speak today. Special thanks to Ricardo for his excellent preparations, and greetings to my fellow participants in the online audience. Just a little bit about me. I'm a trained neurosurgeon. I visited DPRK over 20 times since 2007. I direct the North Korea program at the Korean American Medical Association. Our aim is to support the medical care of the DPRK people by working alongside the North Korean doctors. Much of my understanding of the DPRK's health system is informed by my on-the-ground work there. I'm also trained as a global public health practitioner, and as an academic, I choose to study DPRK and things like disease patterns and trends, its healthcare system, and factors that influence the health of its people. And these factors are not just health factors. These ranges from domestic policies all the way to geopolitical factors, such as sanctions and the impact of the ongoing state of war. And we heard some of that from Osa's presentation and the impact the current sanctions has had on the, at least for her NGO. I have some key messages I'd like to convey. First, health has always been and continues to be a priority for DPRK. And international sanctions have had actually a deadly impact on the vulnerable population of the North Korea. And DPRK actually accepts international health, which is clear, but is not dependent on it. And measures to prevent the COVID-19 outbreak may actually have wider impact on the health of the North Korean people than the disease itself. And then lastly, health assistance can lead to diplomatic opportunities. So let's talk about how North Korea prioritizes health of its people. Well, it's ingrained in their constitution, Article 56, it actually states that medical service is universal and free. It's a socialist country, and this is not surprising. Now, I hear stories like, the North Korean government has abandoned its citizens for pursuing weapons program. And I think that's an incomplete statement. In fact, I think it's outright wrong. Based on our studies, North Korea actually has a fair amount of budgetary allocation to its health sector. So we're working on this project currently, and it's not published, but we're estimating between $1 to $1.8 billion a year that the North Korean government is spending on the health sector. And this represents, and it depends on how you measure the GDP, but between 6 to 6.4% of GDP, which is a respectable number given its income class. I mean, this is more than some of the other countries, and these other countries are not even, doesn't have a massive budget on the military like the North Koreans has. One thing I want to mention is that the North Korea's government actually prioritizes health over economy. And I'll give you a data point for that. And this is when they shut down the borders and shut down almost all the trade with China. That's a massive loss of revenues. The tourist industry has been shut down, also another source of income. But to the North Koreans, the idea of protecting its citizens, is more important, is paramount, and it's at a steep cost to its national economy, and they will do that. A couple of other things. As a surgeon and a doctor working inside the North Korea health system, I can tell you that they've developed a prototype CT scanner that's at the Kim University. And it's astounding to me that they have been able to do it. And I've seen the image qualities that came out of the CT scanner, and it's quite good. They have also developed and manufactured and now implanting artificial knee joints inside, for their patients. And so this is an example of how the North Koreans actually invest in and actually deliver as best as they can within their constraints, medical services for their people. And then you've also seen that with the COVID pandemic, the DPRK government has really tried to respond to it. I think one is the fact that they're building this massive hospital in Pyongyang General Hospital. The other one is the opening of a medical oxygen generation plant in the north part of the country. So they are investing in the health sector. They have sustained spending on this sector. And it's actually a high, it's a matter of national survival is what the DPRK government has actually said. And then let's talk about the international sanctions. We heard from OSA the difficulties that the Swedish Red Cross is having on its programming, budgetary restrictions, administrative constraints. But what does it mean? We wanted to put a number on actually how many people, this is the vulnerable population of North Korea, could potentially have died as a result of sanctions and funding cuts. And we conducted this study in 2018, looking at the 2018's programming, at least for the UN's intended programming. And we came up with a number of 4,000 people that could have died as a result of the delays due to sanctions and funding cuts. And most of them, 3,000, were children and women. So it is having a deadly effect. Of course, you can criticize our methodologies and say, you know, do you have primary data? No, we can't get that, as you all know that. But it's important also to try to come up with a number to the best of our abilities, because we really want to know what the the human cost is of these due to these policies. Which I just want to make sure that you also understand that the sanctions not only impede external assistance, but it also impacts the DPRK's ability to care for its people. They have no way to seek for sanctions exemption, and they have the same customs and financial channel barriers in trying to bring in parts for their medical equipment. So, and then the last thing I want to say about the sanctions is that, you know, when the pandemic hit in January, the US came out and said, we will offer assistance to DPRK to fight the corona pandemic. I thought that was a very nice gesture and an expression of solidarity. However, they still demanded at the UN Security Council level that humanitarian, they didn't offer a blanket exemption for humanitarian assistance. They still expected that exemptions be sought at the Sanctions Committee, which I think is absurd. This is an international public health emergency, and to ask for permission to send in humanitarian goods in this time and days, it's immoral. All right, so let's go on to the issue of international assistance. So I think OSA also mentioned that there's been a significant drop in the financial support for humanitarian aid programming inside North Korea. And this is the data coming out of the United Nations Financial Tracking Service. And you can see, starting about 10, 15 years ago, the amount of money that the donors have been pledging for assistance in North Korea has gone down dramatically. And this is not just on the health sector. This actually includes all humanitarian assistance, such as food aid. So right now they're at about $20–25 million a year of external assistance. That is not a lot of money. That comes out to be about $1 per person per year of external assistance. Compared to other countries like Vietnam, Myanmar, this is really not this is almost, you start to wonder if DPRK is really willing to invest in their internal apparatus and capacity to manage this external assistance. It may not be worth their time. And this is why you don't see the North Koreans budging in any way when there's when humanitarian assistance or denial of assistance is used as a lever of pressure. It's really not an effective lever of pressure. But what I would add is that the humanitarian assistance is aimed specifically at the most vulnerable population of North Korea, and it's really a lifeline for some of these people. So you have to really weigh the benefits and the risks. Okay, so let's talk about two scenarios. One is what would happen if there was to be a massive COVID outbreak inside North Korea. These are all obviously modeled scenarios, and this actually comes from the Imperial College Modeling Center, and they actually looked at DPRK's situation, and then using active suppression and mitigation, best case scenario, if the North Koreans see the outbreak and they suppress it, maybe 7,000 deaths in total. But in a worst case scenario where the virus just goes all over the country uncontrolled, which is highly unlikely in North Korea context, but if it were to happen, we're talking about 158,000 deaths at the worst case scenario. Okay. Now, what's been happening is that the North Koreans have been basically placed themselves in a bubble, right? And restricted all kinds of border movements and also domestic movements. This is causing supply chain issues for health systems, a reduction of people seeking medical care within the health systems. And you can see this happening not only in DPRK, but other countries. And if we apply these factors into how it relates to the increase in excess death, not due to COVID, but due to the degradation of health systems and other factors. We're doing a modeling study now, and our preliminary results show that as many as 93,000 North Korean people could die per year as a result of the increase in poverty, loss of revenues from the trade with China, the healthcare system being undermined, those kinds of issues. So really, as the pandemic continues, the deaths from the policies to try to prevent COVID from coming in could be more than if the COVID had come in the first place. And this is a real serious problem. So I'm going to finish with this slide. You know, I'm in public health, and we've always said peace is a prerequisite for health. It's one of the most powerful forces that determine the health of a society. But in the case of North Korea, can we look at health as actually also a bridge towards peace, right? So right now, there's a fair amount of increasing appetite for additional cooperation beyond what was available before due to the COVID pandemic. So in global health security, people know that international cooperation and solidarity is essential. We're as good as the weakest link. So there's an appetite to be reaching out more to the North Koreans at this point. We know that DPRK is now currently sustaining and will continue to sustain heavy economic and social damages. And there's an urgent need to find practical and innovative ways to help with North Korea's response to the pandemic. And I have just one quick suggestion. We just heard that the Chinese are going to conduct 9 million tests within 5 days in one of their cities where they found an outbreak. The technical capabilities and capacity is there. It's not even, there must be a way to provide the North Koreans a way for them to surveil and also test, so that will allow them to relax some of their concerns and fears about the virus entering. For instance, provide them with plenty of PCR machines, rapid diagnostic kits, all the test kits that they need to test all foreigners, humanitarian workers, diplomats, so they can start coming into the country, bringing things in and those kinds of things. And I think that's a very practical thing that we can provide to the North Korean government, so that they can start allowing things to reopen, at least from a humanitarian standpoint. And we know that from a North Korean standpoint, that they have a very high level of concern, and it's something that aligns with the humanitarian organization and the North Korean current priorities. And international support will be considered very high value. And I think that could open diplomatic paths to sustainable peace. So thank you very much for this opportunity to speak with you.
Well, thank you, Ki. Very, very interesting and very informative. Really, a lot of thoughts that are provoked by your excellent presentation. Thank you so much. I now have the pleasure to give the word to Dr. Bernhard Seliger, who will give his presentation. Bernhard?
Thank you, Lars, and welcome everybody, and thank you for inviting me to this exciting seminar. I would like to talk today about the current humanitarian crisis as a triple crisis. So looking at as well the COVID, the pandemic, which we mostly looked at For now, sanctions and natural disasters. And just for those who don't know it, our foundation is a German foundation working worldwide in more than 100 countries, among them in South Korea since 1987 and in North Korea since 2003, on reconciliation and peace on the Korean Peninsula, and specifically North Korea currently with projects on sustainable forestry, on nature protection, etc. But I will not talk today about our projects, but rather want to talk about these questions: how do sanctions, the COVID pandemic and natural disasters interact, and what would be the problem for North Korea? First of all, again, we know very, very few things about North Korea, and I would say the impact of sanctions is not so clear. And that means neither the humanitarian impact, nor the impact on the economy, nor the impact on politics. We have very, very diverse views on this. And a year ago, when we had not yet the pandemic, which put special condition on everything, there was really no consensus. Would sanctions work this time? Would sanctions not work at all? And would the economy be crumbling rather from sanctions or being thriving? Could find all opinions. And the same is then true even for much more specific questions, which in the context of other countries we easily could answer. In the end of 2019, Kim Jong-Un said North Korea had a bumper crop, but at the same time, international observers and the international community, World Food Program, etc., spoke of a widespread lack of access to food and shortfalls in the harbors. So whom should we believe here, really? I mean, because they are so far apart, the opinions. Let's have a look at specifics there. The first thing is, if you look at the direction of economic policy in North Korea, we find a hardening and a preparation for hardships much earlier than in the current corona pandemic. Already last year, you have this wonderful picture. Let's go to Mount Pektu. It's actually a very, very sad story that these people were sent up there to pledge to overcome all hardships. That happened already end of last year. And in my opinion, we see that sanctions seems slowly to bite. There were preparations for the grim years ahead, something which in the first years of Kim Jong-un's reign, extra was avoided to talk about. There was more propaganda on autarky, and not only on national autarky, but also regional, the strategy of the so-called frontal breakthrough through all problems. There were responses in agriculture, I will talk about in a minute. And though there were persistent sanctions violations, they are not really enough to make up for the losses in regular trade. Let's look at one example: fertilizer, an extremely important input in agriculture, but production seems to be difficult. And now this year, importation practically stopped. And the most important fertilizer complex seems to have to be at least partially out of action. And then North Korea started to promote around the turn of the year 2019-2020, so-called active fertilizer or fermented manure that is basically self-made fertilizer, which you see everywhere applied in the country because there's no more artificial fertilizer. And the same was true then that this completion of the Sunshan phosphatic fertilizer factory was widely celebrated in DPRK as really a major feat there, and this shows how important that issue is. Now, it's not yet an important issue for this year, maybe, but if you think that through COVID we had a complete stop of importations practically, it might be a very, very serious issue next year when this year's harvest is over and there's no more fertilizer to apply. We see also that at the same time, North Korea stressed the importance to use every inch of vacant land and to extend farming to low yield areas. That was a persistent topic. Many, many times it was reported. Though these low yielding fields would not make sense in a market economy, here every inch has to be farmed in DPRK. That includes, for example, very stony fields like here in Kangwon with very, very low yields, where you could argue that the the labor force could rather much better be employed in other ways than to farm these areas. But that shows the hardships North Korea is in. And then also we have the propaganda of autarky. And as you all know, or probably many of you know, Kangwon-do is always a role model, and it is basically the home of Kim Jong-Un. And there were these stories of Kangwon province being a completely self-reliant economy, which means nothing else than they have nothing more to expect from the center, but they have to fight or fend for themselves. You see that everywhere in propaganda in this year. And all of this was before the pandemic set in. That's very important. So the hardship certainly was increased by the pandemic, but it didn't start with it. Sanctions, evasion is going on. And you can even see it on the ground. If you go to Rason, for example, you see all the time that Pier 2, which is the so-called Korean pier, where the Korean ships themselves, it's always full of coal. This coal goes somewhere, that is China, and it's basically prevented by sanctions, but not really. Nevertheless, the sanctions evasion cannot at all make up for the problems North Korea has through the interdiction of legal trade. And here is a estimation from the last panel of expert report, where you see that they now are thought to export something like 370 million US dollar in coal, compared to 3 times that in 2016, when coal exports were still legal. So they have a massive loss here. And you see that also, though it's a topic we don't need to go into too much here, in the issuance of government bonds, which seem to have been there to control flows of foreign currency. Now we talk about the impact of the COVID pandemic. We'll not talk about the question if they had an outbreak or not, but clearly we can say that the conditions for containing the pandemic at the border are given, but there's probably no possibility of sufficient testing. Kim Jong-un spoke, I think, a few days ago about the thousands of tests they did, but it was literally 1,300. So really, really much less than in any other country. They reported very early on COVID-19 in their press, which was different from former times when we had the MERS or Ebola outbreak or others, and they closed early the border, and that was probably a very good thing, because it helps them to contain or to prevent any larger spread of the pandemic, though there might have been cases. And we also should see that the restrictions of traveling inside the country are enormous in normal times and have been still increased in the pandemic. So that means also that inside the country there's much less movement of people, and that's probably good. However, we should also see, so if we talk of the question if North Korea really puts the health of its citizen in front, we had the parade with hundreds of thousands of people without masks there. I mean, there would be no better super spreading event than such a parade. Anyway, we should also see that the health system indeed has been a longer term priority for the leadership. It's not a priority only of COVID-19, and that includes very interesting things like science and technology. That's a little bit a mantra of North Korean. I think also a very wrong focus, because they will not leapfrog. They need appropriate technologies and not cutting edge technologies. It includes health finance. We had last year, for example, the trip of doctors to Germany studying health finance, hospital building, etc. And that's also interesting. The new hospital, which now has come to such a prominence, indeed has already been announced in early 2019. So it's a longer term plan for building this hospital. It's only been more promoted these days. Now, in terms of the effectiveness of sanctions, we really can ask, did COVID-19 achieve what the sanctions could not, namely completely seal off the country? And I guess we can say so, yes, it did. Finally, we talk about disasters in North Korea. Those of you working in the health field know that we have all kinds of disasters in North Korea, and disaster preparedness is not very high. We have sometimes too much water. This is a picture we took in Rason in 2015. We have sometimes too few water. We have practically every year we had, besides this year, which was at the highest precipitation since 1981 in some provinces, and one of the highest in the others. We had before most years severe problem of drought in places. This is, for example, in Kangwon, I think near Pyongyang, I guess, somewhere. We have forest fires every year coming up and related clearly to dry conditions also. And then we have the long and cold winters with freezing conditions. As Europeans, we often focus on climate change and on the potentially bad effects of too hot weather, but clearly for the North Koreans, too cold weather is of a much greater concern. It's also a much greater health problem for the North Koreans because people die from cold there. You see here these in this picture, these, which is not so far from Pyongyang, you see these heaps of cheap coal dust which they use for heating. We should say though that sanctions had a very interesting effect, namely the adverse effect that coal became cheaper and cheaper because it could not be exported anymore in such measures, and that's one of the reasons why Pyongyang is ablaze with light these days, and why the people had two very, very warm winters compared to the past. And good development, basically, that recently there seems to be more responsiveness to disasters. These are all pictures of the KCTV when they sent out the functionaries of Pyongyang to help in those areas affected by disasters. You might dismiss this as propaganda, but it's a new form of propaganda for a new form of kind of rapid response. It might be related to the fact that international organizations are not anymore able to help, or that there's no more willingness to accept their help, but it certainly also shows there is some movement. And it might also be related to a longer term trend that international organizations really help North Korea to prepare a little better for disaster risk reduction. And we heard already the presentation from the Swedish Red Cross, and the Red Cross and others like European NGOs were quite a lot involved in preparing for a new disaster risk reduction strategy, which was certainly easy because it was a kind of least common denominator for those who were interested in stopping all aid because of sanctions, including humanitarian aid, and those who wanted to come to a more full development aid in the international community. This new disaster risk reduction strategy is very modern, I would say. And here you see some of the content of this the strategy. Sorry. Just one thing, what struck me very much is these 3 actions plans they had until 2020, 26 and 2030. So very, very detailed. Now the first one of them is probably already obsolete because the strategy was done before there was the COVID pandemic, but it shows that there is some preparation going on. Last but not least, I want to point out one thing. I think the biggest problem for North Korea, despite all these temporary, low severe problems, will be that we have a long-term development in the last 2 decades at least, that we have a tale of 2 North Koreas. We have a very modern North Korea, which you see represented here by the new science and technology complex in Pyongyang, by these very elegant young ladies of Pyongyang, which you see everywhere. And then we have this bitter poverty and this backwardness in technology, which we see everywhere, mostly everywhere else in the countryside, but maybe with the exceptions of a very few places, a resort here or a new city there. That's a problem for North Korea with a very modern Pyongyang. with new technologies, including wireless available and all kinds of technological goodies, and this city full of lights. That's a new Rason street in Pyongyang, maybe 2 years ago or 1 year ago. And then you have the others living in the countryside in a very, very poor life. I think that will be the greatest challenge. I think the government saw this. And that was one of the reasons why they talk so much nowadays about the building of new buildings in the flood-stricken areas and about the new village movement. By the way, very interesting, because we are also working in forestry as well. This new village movement, as also the afforestation battle, remind us very, very much of the situation here in South Korea, where I live currently 60 years ago or 70 years ago. So maybe they took really a lesson from that. And I think if they cannot solve this problem, North Korea will have very, very big problems with potential unrest in the countryside. And we hope this can be overcome. And I also would say international organizations have quite an important role to play to help them also bridge this and recognize the dangers of this. You have parallel societies there. I'm looking now very much forward to discussion with you. Just maybe some last words. Will there be a frontal breakthrough or maybe a new catastrophe? I think the one problem which I already mentioned was this reliance on science and technology. Certainly not wrong to develop science and technology, but it's deceptive to think this will solve the problems of society. The main problems are really the problems of the economic structure of the country, and they are not addressed by introducing some new technology, neither in the military nor in the civilian sector. Pandemic was a chance to return to the negotiation table, but unfortunately, until now, North Korea rejected that very much. And also on the ground, our contacts always say you can bring everything, but nothing from the US and nothing from South Korea, which is very sad in a way. Sanctions seem to bite, as I said, and the alternative to a more broader international cooperation would really be an ever-increasing reliance on China. But the question is if this will really bring stability to the country. Thank you very much.
Thank you very much. Another very informative and interesting presentation. I now turn to our last speaker, Dr. Sang-Soo Lee, who is, as I said before, head of the ISTP Korea Center. So please, Sang-Soo.
Thank you, Lars. Hello?
Yes, hello.
Can you hear me?
Yep.
Oh, yes. Thank you, Lars. Thank you very much, all previous speakers. Actually, I'm working more on security and peace building issues on the Korean Peninsula, but this is my great honor to join today's discussion with a real eminent expert on today's topic. Actually, the previous speakers already talked about many issues. I just wanted to add two areas. One is the recent economic situation in North Korea, how it has been impacted by sanctions, COVID-19, and natural disasters. The second one is I want to touch upon on social aspect, side effects of North Korea's strict anti-pandemic measures. So I agree with what Dr. Selinger said. Sanctions are slowly biting in North Korea. The UN has strengthened its sanctions, expanding many areas, textile, coal, iron, seafood. Actually, North Korea's economy has shrunk by 3.4% in 2017, and again 4.1 point in 2018, according to the South Korean Central Bank. But very interestingly, North Korea made small economic growth in 2019, last year. It is about around 0.4%. It is very small, but it is very important. It was made under the same sanction regime. Actually, main reason is North Korea increased its export to China, especially non-sanctioned items such as toys, wigs, even fake idol shoes. And then on the other hand, a massive Chinese tourist visited North Korea in 2019. It is estimated around 350,000 Chinese visited North Korea. But it is not the case since this year. As you know, North Korea has closed its border with China. This resulted in 90% of drop its export to China. And then at the same time, no Chinese visited North Korea in 2020 so far. So actually the Pitch solution estimated North Korea's economic growth before the outbreak of COVID-19. It was around 3.5%. But they predicted again. And then new prediction is around minus 8.5 at least. So it seems to me the impact of sanctions were manageable for the regime, but North Korea's self-imposed shutdown has deteriorated its economy more seriously. I think so. It seems it means on the other way around. If North Korea reopens its border, probably its economy can be recovered like 2019. It seems North Korea has already prepared for reopening its borders after the celebration of North Korea's Foundation Day for Workers' Party. There are some signals for this. For example, today Yonhap News said major North Korea's harbors, Nampo and Cheongjin, reopened to send some cargo to China. And also, North Korea sent 200 laborers to Funchun area in China. And then another news agency said that it seems the train between Pyongyang and Dandong will be resumed in a week. Then another example is North Korea will likely to resume tourism. It seems to me a little bit when I'm thinking about North Korea's leader's speech during the military parade. He said something talking about inter-Korean cooperation. But in his mind, maybe he's interested in receiving South Korean tourists when the COVID-19 relaxation. And then it's not about, I think, it's a real inter-Korean economic cooperation. But I think North Korea is now preparing for resuming this tourism at least next year. And then I also wanted to talk about the other factor hindering North Korea's economy is already previous speakers already mentioned. Recent natural disasters also having very negative impact on North Korea's economy. North Korean regime has focused on recovering all damaged houses and the bridge or infrastructures. But for me, more serious problems are agriculture and the mining sector, because major producing food provinces such as Hwanghae and Hamgyong provinces heavily were damaged by the flood and followed by 3 typhoons in August and September. It is estimated that 93,000 hectares was damaged by natural disasters. On the other hand, key mining areas like Kumdok and Munsan, where have abundant natural resources such as magnesite and iron and coal. Since those areas were heavily damaged, and I think it could undermine upcoming North Korea's weapon productions and producing construction materials. My bottom line is North Korea economy has been negatively impacted by 3 crises. First, the impact of sanction, and then added by COVID-19, and then by the natural disasters. And then now I also wanted to talk a little bit about social impact because North Korea has taken very strict anti-pandemic measures. The first, since North Korea has crossed the border with China and Russia, it's longer than 260 days. It seems some criminal activities are increasing in the border areas because small businessmen and peddlers now they lost their incomes from boat trade. And then now they are easily to be involved in some criminal activities such as drug dealer or smugglings. And then second social impact is since North Korea keeping movement restrictions, now people cannot travel to other regions. Materials and goods are the same. It is difficult to send them to other areas. So I think this, in long term, it will undermine North Korea's general economy, but also increasing the gap between rich and poor regions. And then thirdly, the social impact actually is more and more on North Korea's kids and women, because North Korea is still closing the school, most of schools and daycare, especially rural areas. So most of North Korean kids are not taking any online remote classes, because simply there is a lack of internet connection and personal computer equipment. And of course, moms, their burden is also increasing, because kids are staying at home, and the woman is now taking care of kids and also take care of the house incomes. But more social problem is the trend of malnutrition among North Korean kids is getting worse, because normally North Korea schools and daycare are providing nourishing meals and lunch to the kids. So my conclusion is the recent North Korea's measure handling all recent crises are not a very sustainable way to overcome in a long term. Under the current situation, people are more suffering from economic and social pressures. And then maybe good for them to reopen channels with the international community to resume more humanitarian activities. So thank you very much.
Well, thank you very much, Sang-Soo, for this presentation. We have now finished our 4 presentations, and we can open up for questions and answers. You have the down at the bottom, I think there's to the right, there's a button you can press and ask your questions. And we have already one question, but while this while the audience is thinking of questions and while we're waiting for them, let me begin by asking a few short questions, and perhaps you can give some very short answers. My first question is to Ki. You mentioned that you have been working together with North Korean doctors and physicians in trying to enhance their capabilities. I wonder, what about textbooks? Do they have, I mean, any physician or anyone who wants to educate himself or herself to become a physician needs the latest textbooks. Are they available for the students, medical students in DPRK?
The short answer is yes, but it's always not that simple, right? So they have a medical library with textbooks and journals, but they're contained in a central facility, and you have to go there and read it and come out. But they do have the latest textbooks and journals. But that's the good. So in theory, they have access, but they do not have access to things that you and I take for granted, like the ability to Google, medical conditions or PubMed search for latest medical literature. So that's a big information gap.
Okay, well, thank you very much. And to the other 3 panelists, I'd like to ask some very short questions and ask you to give some very short answers. If you would mention the step forward that we should do and the step backward that we shouldn't do, or that what would lead to a step forward and what would lead to a step backward when it comes to the humanitarian situation in the DPRK. I don't know if Bernard, if you would like to begin. It's a sudden question. I'm sorry.
Yes, it is. It's really difficult to say. I mean, if you would talk of consulting the North Koreans or talking with them in the previous crisis, we saw really that that was a MERS or Ebola outbreak, which were much less severe worldwide. Nevertheless, for North Korea, it meant a very prolonged lockdown or stop of international exchanges. And that's really a very difficult point because they seem to have the kind of council decision on lifting sanctions, lifting the restrictions. And I think they were very wise in putting restrictions early on for travel because they were really not able to control any outbreak inside the country. But to lift it at the appropriate point of time might be very, very difficult. And as Sang-Soo said, in the moment, the economy is tremendously hurt by that. And that also costs life to them. So to find the right balance seems to be very difficult because it's a political or a council decision they have to do.
Thank you. And also, what would move things forward and what would move things backward?
Yeah, good questions. I'm thinking as a humanitarian actor, I think what's important is for us to collaborate and to cooperate in this situation and find joint forces somehow to have an impact and being able to take steps forward to continue the dialogue and the communication with our counterparts in country, which is really challenging at this point. And yeah, the step backward would be that we lose contact and we lose this joint initiatives or energies or forces based on the principles that we are under mandate to bring forward.
Thank you. And Sang-Soo, do you have any comment?
Yes, we talked about international humanitarian aid to North Korea, but I'm also thinking it almost depends on North Korea's intention and willingness, even though international community is willing to help them. Because some area, North Korea is refusing to receive humanitarian aid from the international community. So I think how we can overcome these obstacles is how we can convince North Korea to work together when it comes to their difficulties, natural disaster or COVID-19. Maybe good idea is we try to encourage them, North Korea, to join some kind of international cooperation framework, such as UN SDG, Sustainable Development Program. And then it's good for them to understand international norm and the standard, how we are working together on our common issue. But we also need to consider future political development, of course, because humanitarian aid and international cooperation also will be very much affected by this North Korea's future strategic agenda. So it's very difficult, but we worth trying. Thank you.
Well, thank you. We now have a few questions. Let me read the first one. In case of a victory for Biden in the next US elections, do you see any changes how the sanctions will be implemented in North Korea? I don't know if it's a relevant question, but if any one of you would like to answer that,
I'll take that one,
yes,
because I'm American.
Yeah.
So, you know, what they say and what they will do are maybe two different things, right? Because one is to try to get elected first. So, you know, the Biden campaign has taken on a very hardline approach, at least to critical approach to what Trump has done by meeting with Kim Jong-Un. But you know, it's clear. But I would imagine the Biden campaign will not waste away this sort of a relationship that's been built last 2-3 years. So I think there's going to be more opportunities for diplomacy. But I think right now they're taking sort of a hardline approach. Is, you know, Trump is engaging with dictators from around the world, that kind of narrative. But I just want to have a chance to just respond to the previous question, a step forward, step back, if I may. And a step forward is, for me, is a bit ambitious. The post-pandemic era represents a massive opportunity. And as you heard from all the other speakers, assistance to North Korea is just one aspect of it, but there needs to be a reset, an overall strategy. We can't just try to deal with banking channel on one end and, you know, food and clean water on the other end. We need a comprehensive strategy that brings in all the stakeholders and then come up with a way to deal with all these aspects in a collective manner, because it's right now not working, right? So that's sort of the step forward. And to Sang-Soo's point, we have to figure out a way to address North Korea's fears, concerns, security, non-traditional security concerns. In this case, they're afraid of the COVID-19 coming in, and for us to not address that is a huge mistake. And so that has to be done first, right? And when they refuse humanitarian assistance, it is not politically driven. It's out of fear of COVID coming into their country. That's what really it's coming from. It's not they're trying to make a point politically. And then a step backward for me is that a failure to act is completely unacceptable. That would be a step backward. Thank you.
Thank you. Yes, go ahead.
Yeah, it's my simple answer when it comes to Biden, if he will increase the sanction. My answer is more or less is the same. Both either Trump or Biden, they will keep same sanctions. But I think if Biden is elected, then maybe he is interested in imposing sanctions on the human rights issues as well. So my answer is at least it could be increasing, but it's more or less the same.
Thank you. There's also a question here about hospitals and health resources. Are they evenly distributed over DPRK? And is the ambition of the government, DPRK government, to distribute them evenly, or are they concentrating on certain areas only? I don't know if...
Is this a question for me?
Yeah, probably, yes.
Yeah. So I think Bernard, he really showed it during his presentation, the increasing urban and rural disparities. And this is an area of significant concern. And that's a valid question. I would add that for North Korean government, for them to control COVID within their country, they cannot distinguish between elites and non-elites. For them to do that is a flawed strategy, right? You really have to vaccinate the entire population and manage it comprehensively. So once again, I argue that the post-pandemic era represents an opportunities to address these disparities even further.
Maybe I could add a few words.
Yes, please.
Well, it's actually an outspoken strategy to say we want to have world-class hospitals in Pyongyang first, and then there's some idea to have something like a trickle-down effect from that to the countryside. But for the time being, it means in reality that in the last 30 years we had a lot of hospitals, very small polytechnic hospitals, so comprehensive hospitals in the countryside which didn't receive any resources at all, which really lived on what the international community gave, let's say Red Cross, etc., or on the self-collected herbs also, which they use quite a lot in the countryside. So it's often a deplorable view if you come to small city in the countryside there. But there is an idea, and that's why they also have this telemedicine, which was a big issue with the WHO a long time ago, that they say, okay, we have now telemedicine, so we can be in Rason and still get the best advice from doctors in Pyongyang.
Thank you. And another question here is directed to both Key and Bernard. It's about the border closure and how it's impacting your work inside North Korea. Do you see any changes, and how has it impacted your work? I think you have mentioned it a little bit, or mentioned the situation, but perhaps you can elaborate a bit on how it has impacted your work.
Well, in our case, we have no office in Pyongyang, so obviously, since end of last year, couldn't travel there anymore. Still, we have contact to our various partners via email, which is quite good, and we see them working on this or that issue. We do, for example, publications together, which they still worked on, and preparation for projects, etc. But without visits in the country, our main focus is capacity building, no capacity building.
Thank you.
Yeah, for us, I mean, our travel is suspended due to the COVID travel restrictions, right? The good news is that the US State Department is now considering, and I think it's going to happen, a multiple entry special validation passport for US-based humanitarian aid workers. Before, we actually had to get a new passport for every time we traveled into DPRK. So there's some relaxation, I think, on the US side. But as far as the DPRK side, it remains to be seen when we can travel again.
Maybe I can extend that question to Åsa as well, how it has impacted your work.
Yes, of course, it has impacted a lot on the, for example, on the monitoring aspects, and for us, national societies supporting the different programs within the country, and not being able to visit the program, meeting with our colleagues, both at the International Federation Office and the national societies, our local colleagues, discussing programs, follow-up, planning ahead, analysis, and having this direct dialogue with our counterparts in the country, as well as not meeting people in the communities that we are supporting. Which is really important in this setting as well, to have our eyes and ears in the country. And previously we were able to travel a few times per year and in and out. We didn't have any problems with visas or access in that sense. That has actually improved, like I mentioned, the last years quite a lot. So it has had a huge impact on that those aspects for us.
Thank you very much. Now we have a question directed really to Sang-Soo. The impression from what you said earlier was that you can see an opening up of the DPRK in the near future, or in the beginning of next year. And would you agree that this is the case? And do the other speakers also agree that there is a chance of an opening of the borders for people like you? Sang-Soo, if you can begin.
Yes. Can you hear me?
Yeah.
Yeah. I think it's more depends on how North Korean regime feels safe if they open the border again. But if we think about if economic situation is getting really worse and worse, becoming more threatening to the regime than this COVID-19, of course, they should consider to open the border. And then from strategic point of view, North Korean regime should show two leverages. One is they have to show we are overcoming this economic sanctions, taking their self-reliance policy. But somehow they need to show our economy is fine with under these sanctions. So one option is to open the border with China to receive more resources from China, including tourists. And then other strategic point of view is to show their military leverage. During the military parade, also North Korean showed new advanced technology. So both two leverages is if they are considering to sit with the US for the next or future nuclear negotiation, then economically they have to show their strengths. They are overcoming this difficulty. At the same time, they have to show this military leverage. So I think it's under this situation, yeah, probably they will consider reopen the border.
We have very little time left and many questions. Sorry. So I wonder, maybe we can somehow summarize them together. One question is, are there any international efforts underway with the DPRK government to reopen international humanitarian channels? And another, will the borders open only when there's a vaccine or a treatment available? Are there international actors that are currently working on disaster risk reduction projects in Korea? And finally, let's see here, that there's an argument that the North Korea tries to hold up humanitarian aid as leverage in negotiations with Washington as well as Seoul. And yeah, so there are a lot of related questions, and you have 1 minute to answer. Who would like to start?
Okay.
Yeah, okay, Bernard.
Okay, one thing on the disaster risk reduction, as I said, there were actors like the Red Cross societies and the Swiss Development Corporation and others who worked since several years already on that, and who did, I think, quite a good job there. And the other thing, once more to the border opening, there's an opening and an opening. What I think we refer to for the short run, that's the opening for transfer of goods. And that's really a lifeline for North Korea. They cannot do without. But the border opening for health workers, for diplomats, and finally for tourists, I think it's very, very far away. And I would predict, first we have to wait until Russia and China opens, because without them anyway, and China is basically also closed with their long quarantines. And then probably if we have a vaccine plus fast rapid testing available, maybe North Korea will open somewhere mid or end of next year. I don't see it before.
All right. Any final comments from any one of you that you feel that you haven't been able to point out or say? If not, I think it's time to thank you very much for your valuable presentations and very interesting details that you provided us with. And I also would like to thank the audience and all those who posed questions to us. I'm sorry we couldn't answer all of them, but that just means that the topic is extremely interesting, and maybe we can have another webinar further on. I would like to thank you all on behalf of ISTP, and we look forward to see you soon again, perhaps not this way, but also in person. Thank you so much, and goodbye.
Thank you. Goodbye.